Bob, be careful with that
Yep.
thing. Anyways, the whole point of this is, do you have front of the hip pain or pain that kind of comes into the groin right here?
Well, lucky for you, we are sure how to get rid of it.
That's right. We're going to take care of it, and this is a really interesting method. So
It'll be gone.
Yep.
Bob and Brad, the two most famous physical therapists on the internet.
Okay, there's actually a term for this. It's called anterior
Anterior
femoral.
femoral glide syndrome.
Right. It can certainly cause pain anywhere in the hip,
Around the hip, right.
but typically it's in the front of the hip.
Or in the groin.
We're using Sam here to show how this works mechanically and how we're going to fix it, or how you can fix it.
Right.
That's it. Okay, so the hip joint, obviously you have the femur and the femoral head, the ball of the hip.
In the socket.
And the socket. Ignore this metal thing. That's just part of Sam's anatomy. It's
Right.
not in humans. So the ball naturally fits in the socket. And what happens, what we do not like, and what's happening is the ball is moving forward, or that's the term anterior. You got a good close up of that? There we go. So it ends up like this, and it's not riding.
It's pinching.
Yep, pinching in the front, and we need to move it back and get it set into the socket for proper mechanics.
Right. These exercises that we're going to show are from Rick Olderman, and he's got programs that you can link to.
Right. And we're going to show you the exercises that you can just hopefully do right at home. All right, the first exercise you can do to help pull that ball back where it needs to be in that joint is you can kneel down, have some support on furniture, whatever. You can have something to kneel on. It's optional if you got carpet. We just want to keep our knee comfortable. And keep the knee bent like this and go back like this as far as you feel comfortable.
These are called glute pumps.
Right. So we're
Gluteus maximus.
getting that glute maximus to pull, and that actually connects right to that femoral head and pulls it backwards, doing what we want.
Should you have bad knees, you can do it standing.
Yes.
Lean against an object and bring it up like this.
There you go. Is it something that you need to be leaned over for, or could you do it on a taller object?
You could probably do it on a tall
Okay.
average.
But keep the knee flexed and get that same motion.
Right.
You'll feel that glute muscle working. 10 repetitions.
10 to 15.
10 to 15, sorry.
All right. This one's important.
Okay. The hip flexor
Right.
stretch. This is a nice one because you use gravity and you just relax and let gravity do
And
the
it's very
stretch.
tight on most people.
Yep. Now, you probably need to do this off the edge of
A bed, right.
You know, hopefully your bed is firm. It'll work a little better. But
Might put a pillow underneath you.
oh, sure. Underneath your
Right.
bottom, your hips and your buttock there
Right.
to elevate and support that better. But the whole idea is this is the hip I'm stretching.
Right.
I'm going to take this knee and support it
Kinda
here.
lock the pelvis.
Yep. You could have a stool to start out
Or a
with.
chair.
Or a chair, whatever you want, but we're going to go down. And if it's not stretching and you straighten that leg out, now I'm starting to feel a stretch. And if that's as much stretch as you can tolerate, that's fine. Start there. So I'm going to stretch and relax. Stretch and relax. When that starts to loosen up, and it's really important that you breathe and you stay completely relaxed, you'll have much better success. So, you know, don't have the dogs running around or the kids coming over and pulling on you. Now,
When you're ready.
yeah, when you're ready, discharge or get rid of the chair and let that knee and leg just relax and gravity's
See,
pulling.
Brad's a little bit tight
Yeah.
because his knee doesn't bend as much as it should.
Now, if I want to get it a little more aggressive, you can go closer to the edge. There's a point where you'll know not to go any farther because it just hurts your back, and we don't want that. And if I pull up here,
And try to bend the knee a little bit.
yep, and flex that
Yep.
knee, that gets a couple of different muscles, the rectus and the sartorius, which is nice to get. So, Bob, do you recommend holding it for like 15 to 30 seconds
Sure.
or doing a pressure on, pressure off.
Either way,
Whatever you feel comfortable with.
what works?
You should not create sharp pain. It should just feel like a nice stretch. in
Great
that
one to
area.
do. That's good for knee pain too.
Oh, yeah. Yep. It gets things from here down, Bob, I'm ready to run a marathon.
Ready to rock and roll. The third exercise is a hip mobilization, Brad.
Yeah.
Let's show. Go to the
Yep.
door.
This is a different approach, but it works quite well. All right, for the 2 hip mobilizations, you're going to need a belt. This is a canvas belt, anything sturdy. It'll need to be about this diameter, depending on the size of you and the height of you. But once you get that belt, you're going to open the door with the doorknob. And it doesn't matter what kind of doorknob it is. You're going to loop it around the doorknob like so. Okay. Get this twist out of it and probably go below where it
Roll the
latches.
lock, right.
And if you have a lock deadbolt, I would put that on. It just makes it more secure so that if it comes loose, you probably aren't going to get hurt, but just be safe. It assures if anybody from the other side decides to open the door while you're doing this, is unable to.
Hi, Brad.
Yeah, we'll have none of that. Okay, now the first thing you're going to do, you're going to come up high.
Way into the groin.
Yep, way up into the groin and up high. We want to get to the femoral head, the hip joint itself. I'm going to put weight through the leg that I'm treating, and I'm going to push forward. Now, you should be able to see, if we get close to the camera, as I lean forward, again, the weight is on the hip being treated. Lean forward, it's going to pull that joint in a posterior or backwards direction. So you will pressure on, pressure off, pressure on. This should not create any pain.
No pain whatsoever.
This should feel like a stretch.
It's kind of like you're oscillating, Brad.
Yep, on, off.
Now, if you have a total hip
Yep,
or RRA, or if you are hypermobile,
yep,
don't do this.
yep.
Absolutely do not.
No hip surgeries.
Right,
RA, rheumatoid arthritis.
right.
Hypermobile people. Now, once you do 10 of those, you're just going to turn 90 degrees, and you can do it like this. I'm going to turn like this, just so that the camera can see it. And now we're going to pull that direction to the side. We call it lateral force. And I think you can see this even more clear. I'll get this kind of out of the way, and see how that put pressure on? I'm putting
That's
it.
going to stretch the capsule.
Yep. So that capsule encloses the joint, keeps the synovial fluid or the lubrication fluid in there, but we want to stretch that capsule so you have more
'Cause
motion.
it can get tight.
Yep. It's one of those things that's really hard to do with other stretches
It
that
is.
stretch the muscles.
Right.
The hamstrings or glutes, and
Takes a lot of force.
Yep. And 10 of them that way. Again, it should feel comfortable, like a good, comfortable stretch.
This can make a big difference.
Yep. And then simply, if you need help getting in and out, make sure you have help, or because we don't want anybody to fall. And then naturally, take care of your tools and put them away and close the door. All
There
right.
we go. Thank you, Brad. There you go. That's all 3, Brad.
That's right.
We did our job.
Good job. Now it's time for you to do yours.
Get rid of the pain.
Get rid of the pain and enjoy that walking, running, whatever you're doing, but eliminate the pain.
In the front of the hip.
Yeah, I guess that was kind of a dead outro.
There we go.